All right, good morning. This is Senate Health and Welfare. It's Friday, Ides of March. And we are looking at several bills this morning for possible markup and vote. We've been through all of them, the final drafts of each of them. There are 215 we might consider changes or not. So why don't we just go through and see how we want to proceed with possible votes. And Michelle, you're here, but there aren't any changes from what we looked at?
Yes,
Yes.
yes.
Oh, yes, there are. Senator Goulart has been working on, okay, why don't you come share this? That's right. We said Senator Goulart got an assignment and Michelle was working on it. It's good.
Just all came through.
Good.
Morning. So do y'all just want to follow on your devices or do you want me to put it up on
I'll
the
put it
screen?
up and then everyone else,
Sure.
there can see it.
Great. Okay, for the record, Michelle Childs, Office of Legislative Counsel, and we're taking a look at a redraft for the amendment for S-114 regarding the psychedelic therapy advisory working group. And so what I did for this version is there are no findings in this version. So there's just two sections, which is the first section is creating the working group. And the second section is the effective date. So the lead-in language you'll see is, and I did go over this, I think, in the previous draft, and I realized I didn't update the draft number. So my apology for that. I'll have to keep you up, make sure so that it's not confusing for folks on the web. So it's creating the group to examine the use of psychedelics to improve physical and mental health and make findings, recommendations regarding the advisability of the establishment of a state program similar to other jurisdictions to permit healthcare providers to administer psychedelics in a therapeutic setting, and the impact on public health of allowing individuals to legally access psychedelics under state law. And so you, at our last time that you discussed this, you really reworked the membership of the group and who you wanted on that group. So you've got a representative of the Larner College of Medicine at UVM appointed by the dean. And moving on to page 2, it's a representative of the Brattleboro Retreat appointed by the president and CEO.
Gee, that doesn't matter where you go.
It's always on silent, and I realize I miss all these messages from chairs if I
But
don't
the
feel
only
the
time
ding.
it's on silent for me is if I need to wake up.
Sorry about that. So, subdivision 3, member of the Vermont Psychological Association appointed by the president, then a member of the Vermont Psychiatric Association appointed by their president, the executive director of the board of medical practice or their designee, the director of OPR or designee, Vermont Commissioner of Health or designee, and a co-founder of the Psychedelic Society of Vermont. You'll see the powers and duties. I don't think we have changed that since the last version. You'll see new language on subdivision 2, starting on line 6 on page 3. And this is where you wanted to kind of just identify that they're going to be consulting with other folks who are not part of the working group. So I had before in the bill as introduced, it had, I can't recall, but it was a reference to Johns Hopkins, but kind of more of the, it was a different group at Johns Hopkins, but they have the Center for Psychedelic and Consciousness Research that is part of Johns Hopkins that the medical professionals who are working in this area. So I thought it seemed more appropriate to kind of specify that. And then also decriminalize nature, which was had a seat on the working group in the bill as introduced. In addition to any other individuals or entities with an expertise in psychedelics. I don't know whether or not you heard back from Rick Barnett around the assistance piece.
Yes, Martin, we heard back, Martin, did you want?
Around providing
Yeah.
assistance.
Yeah, and we have a letter in our folder this morning, he said that they are happy to facilitate and don't need payment and are very excited.
Sure, great, so subsection D is
It all came
a,
together.
is a designated Vermont Psychological Association, to provide for kind of help just getting folks together and having the meetings, and then also submitting the report that's required. And so, the report is due November 15th. To the Committee on Judiciary and Healthcare, and Health and Welfare and Human Services. And whether or not to proceed with some legislative action on the issue. The Psychological Association's to call the first meeting on or before July 15th of this year. And then subsection G, this language. You know, I realized we didn't talk about this, is that this originally had it for 8 meetings, but did you want to? Did you wanna put a time limit or less than that, or? So the way that this section works with the reference to 32 BSA 1010 is it incorporates that concept of what you guys had spoken with last time about, like, people are only reimbursed if they're not otherwise being paid to be there by their day jobs. And so that's already kind of implicit in that language. So I don't know if you want to designate a certain number of meetings or
No,
not.
let's leave it, no more than 8,
Okay.
for the reimbursement purposes, there probably isn't anyone on that list who will need reimbursement, I don't know that. But,
I think it would probably be a minority, certainly.
yeah, it would be probably the last, who's the last person,
Psychological Society.
yeah.
Right.
He's on society. Yeah,
I don't know if they pay him to do that, right?
don't know whether that's part of his job, so let's leave it. And then
Will this need to, when it goes out, is it gonna need to go to approach?
it's gonna go to a pro.
Right, so they could, you know,
Right, they might say, that'll be a question that I can ask in approach. But what does the committee think about leaving 8 or taking it out?
I was fine with leaving 8.
It's a lot of meetings.
it's a lot of meetings, I'm guessing they're probably not gonna want.
I don't wanna meet that much.
Yeah, especially because it's just a 6-month period. Pretty, or not even, but it says no more than 8, right?
Mhm.
Yeah, so, that's good.
It's July to November.
It can happen, but
Right, I mean, and also like today, I mean, I imagine with people scattered all over from these different organizations, and like primarily on Zoom.
yeah, so let's just leave it at 8.
Okay.
See where the chips fall.
Can I ask one question? So on line 4 on page 4, you have the group ceasing to exist on January 1st. The one question about that is if we wanted them to come in and testify and they don't technically, I mean, we could have all the individuals in, but does it
Yeah.
matter that?
I don't think so, I mean, I get what you're saying, they've, you know, we've been encouraged to make sure that we're always
Yeah,
making sure that it's kind of like there's a cutoff date for these working groups. And in my experience is that when we do that and if we wanna ask somebody in to come and present the report, I've never heard somebody say,
we're not a group.
right, we're not a group
Okay.
anymore or anything like that, so.
Okay.
I don't think it's a problem, I can certainly kick it out if you prefer, but, I don't think there's like a practical need for it.
Okay, I'm fine with it then.
Okay, is there anything else there?
It's good, thank you so much.
Sure, and then just at the end, I re-titled it since, the original title references decriminalization, which will no longer does.
Good, this is good. I think we have all the right people, and it's great that Rick wants to do that. All right, so, is there anyone who would like to make a motion?
I'll make a motion to pass this bill out favorably.
What's?
Bill.
Oh, let me, so let me just double check because I think actually I'm gonna
Change the number.
change this, and I'm
We didn't make any changes just now, did we?
no, but, and Kiki, I'll send you a new version of this. It was just my mistake. I didn't update the header. When I did a new draft before, so let's wait. So this will be 2.1.
Draft 2.2. Oh, we have a few minutes. It's too bad we can't keep you for a few more bills.
I don't know, what would you like me to talk about?
That's it. We've got 3 squares with the community nurses. I don't think you fit. That's,
I'll be with you next week though for H72,
oh, good.
so. Kiki, if I email the committee, does that automatically come to you as well, or do I need to CC you?
I feel like you might have to.
Okay. I just emailed that, so you should have a copy, and all I did was change the header, so it'd be 2.1 that you're voting on.
We ready? Can we do it with draft 2.1?
So it is draft 2.1 of S 114.
So now make your,
Yeah.
or as amended. Do we have to amend the bill? It's S draft 2.1 of S 114 as amended. Then we don't have to have 2 motions, one to amend and one to pass. So if we do it together. So we've been doing that, but just for clarity.
Write it down as amended. Okay, sorry. Senator Hardy. Yes. Senator Williams.
No,
Uh, Vice Chair Weeks. I should have started off. Senator Gulick, yes. Chair Lyons.
Yes.
All right, 3-2-0. Thank you, as is typically the case in this committee. Thank you so much.
Okay.
Sure.
And,
Yes, yes.
and please reach out if, I'm happy to, I have lots of supporting documents and anything you need for the floor.
Thank you so much. Much appreciated.
Thank you, Michelle.
Uh-huh.
Yeah, it's been great having you. So, I think, well, the next bill's not scheduled until 9:45. We have some testimony related to 3 squares, and the other bills are scheduled after that. So, given that there might be some interest in each of those bills, I'm actually gonna suggest that we take a break until 9:45. And then, we'll come back and try to move through with a large